I will, you will.
All right. Behind me is the only thing between you and single-payer health care. A small band of brothers looking for a sister. So we're going to unveil a bill that's been in the making for about a month now. And Bill Cassidy is going to walk you through the details. Rick Santorum's going to tell you how history's on our side. Ron Johnson's going to talk about numbers because that's what he does. And Dean Heller's going to tell you about how this is a good deal for Nevada and the country as a whole. And I'm going to start with the following proposition. If you believe repealing and replacing Obamacare is a good idea, this is your best and only chance to make it happen, because everything else has failed except this approach, which will work if we get behind it. If you want a single-payer health care system, this is your worst nightmare. Bernie, this ends your dream of a single-payer health care system for America. So we need people on board now to stop what I think is inevitable if we fail, which is single-payer health care for all, which is the end of quality and the end of a sustainable federal budget. There are three choices: prop up Obamacare, Bernie care, or our bill. That's where you're at. Count me out for propping up Obamacare. Hell no to Bernie care. Count me in for an idea that gives a patient a voice they would never have under single-payer health care. Count me in for people in my state making decisions about health care versus some bureaucrat in Washington. There's a lot of fight left in the Republican Party when it comes to repealing and replacing Obamacare. The reason I know that is I spent all of August talking about our failure, and nobody was very happy with the idea that the Republican Party, after 7 years, promised to repeal and replace Obamacare, made an effort, failed, and is apparently willing to quit. The question is there any fight left in Washington to repeal and replace Obamacare? Is there any fight in the Republican Senate, in the White House? I can tell you there are a lot of colleagues that are dying to have another shot at health care. There are a lot of colleagues of mine that would like to talk about taking money and power out of Washington and returning it to their state, closer to the patient and in the hands of people you can actually complain to. Under Obamacare, if you don't like it, who do you complain to? You can complain to me, but I don't run Obamacare. Under this block grant approach, which Bill will describe to you, you can actually complain to a state house representative who probably lives in your neighborhood, goes to the same hospital you send your family. You can complain to a governor that you can vote for. Under Bernie care, you complain to a faceless bureaucrat. Under Bernie care and Obamacare, there really is no innovation. Under this approach, 50 states have a chance to deliver health care, and over time, guess what? Some will figure it out better than others, and those who do badly will copy those who do well. Under Obamacare, you're no better than the bureaucrat or the most liberal member of the House and the Senate. This is a defining fight for the future of health care and the Republican Party. We refused to quit. We have been working on a bill that I think should have been our first approach to repealing and replacing Obamacare, not our last, but it is now our last. 4 states under Obamacare get 40% of the money: New York, California, Massachusetts, and Maryland. If that bothers you, this is a chance to do something about it. If you live in a state and you want to keep sending money to Maryland, New York, Massachusetts, and California, then vote for Bernie's bill. Prop up Obamacare. If you believe your state should have more money, more flexibility, and more choice, then vote for our approach. I've been involved in a lot of things in the last 20 years. This is the most important thing I believe I will ever be involved in as a member of the United States Senate. I know what awaits our country if we fail. The consolidation of health care in the hands of the federal government from cradle to grave. Unlimited, unsustainable spending that wrecks the federal budget. There are two approaches we take here. We deal with Medicaid in a very reasonable fashion, more flexibility, more control, and we begin to slow the growth of Medicaid down in year 8. If we do nothing, by 2027, Medicaid will be over $650 billion in spending. We're spending $549 billion today on the military. Let me say that again. To do nothing means that we'll be spending more in the next decade on Medicaid than we do to defend our country. This bill changes that. 40% of the money under Obamacare, where's that chart? 40% of the money under Obamacare goes to 4 states. We level out spending 10 years from now, 2026. Every state gets basically the same contribution from the federal government. Will allow you to adjust for risk. If you have an older population, a sicker population, you can get more money. But the goal is by 2026 to make sure that every patient, no matter where you live, gets basically the same contribution from the federal government. I think most Americans believe that's fair. Our bill levels out an inequity in funding. It allows flexibility that Obamacare would never embrace. It gives patients a voice in the health care they'll never have through a single-payer health care system. And from my point of view, it's the best and last hope for the Republican Party to show that we have ideas and that our ideas are better than our friends on the other side. Last thought, liberals will fight like tigers to the bitter end to get what they want. To those in the Republican Party who feel like we have not fought as hard as we could, you're right. To those conservatives who feel let down by this debate, you have every reason to be let down. Here's my call to the Republican Party and to all who believe that health care should be closer to the patient, not stuck in Washington. We need your help. The only thing stopping us from having this idea debated on the floor of the United States Senate is lack of leadership. Bill Cassidy.
If you were poor, that's where you went. And I learned that if a politician controls the dollar, the system lines up to control, the system lines up to serve the politician. If the patient controls the dollar, the system lines up to serve her. The theme of what we're trying to do is to give the patient the power. We want the system to line up for that patient wherever she may live. Now, some will say, my gosh, what's wrong with the status quo? We should continue it. There's a saying out there, though, that Obamacare only works if you don't. And I will use the example of a fellow named Moon Griffon, who is a talk show host in Louisiana. He is a self-employed person. Moon's got a special needs child. Moon's premium per year is over $40,000 with a $5,000 deductible and an additional pharmaceutical deductible. Think about that. He is going to pay $50,000 a year between his premium and his deductibles. The mortgage of a $500,000 home. And Louisiana is considered to be one of the states in which the individual market is working relatively well. It doesn't work if you work. We try and change it. To give a patient like Moon Griffon or that self-employed person, wherever she or he may live, the ability to have affordable health insurance. Now, by the way, I've been accused of partisanship. The New York Times editorial yesterday opined draconian cuts. I was a little amused because we haven't introduced the bill yet. So in all due respect to the editorial board of the New York Times, you haven't seen the bill. How do you know that there are draconian cuts? Similarly, some of our Democratic colleagues have accused us of partisanship. Let me also say, you haven't read the bill yet. But let me just give some numbers. We're not being partisan. What we do is we equalize the treatment of wherever that patient lives. If she currently lives in a state represented by a Democratic senator which did not expand Medicaid, they do far better. Because by 2026, wherever she lives, whether a blue state or a red state, there will be about the same amount of money provided for her care. We don't think of blue states or red states in this bill. We think of American states, of American patients. And we think those who are eligible for assistance should get about the same. One example, though, the difference between what we provide versus what they will receive, some of these states will receive under status quo, is Indiana will receive $1.3 billion more in 2026 relative to status quo, a state represented by a Democratic senator. Missouri, $1.1 billion, Wisconsin, $1.1 billion, Virginia, $2.7 billion more in 2026 alone under our plan relative to status quo. This is not a partisan bill. This is a bill about the American patient wherever she lives. Let me also say that then some, in fairness, Tim Kaine, senator from Virginia, I'm told after I left the committee yesterday, said he didn't accuse us of partisanship, but he wished that there would be a better process. And Senator Carper said he wished that there would be a hearing upon our bill. I agree. I hope there is a hearing, but let's not be disingenuous. So far from the other side of the aisle, there's been no cooperation whatsoever in attempting to address the issues of someone like Moon Griffon, who's paying $50,000 a year under the status quo. We can do better. As regards the policy itself, we take all the dollars that are, first we repeal the individual mandate, we repeal the employer mandate. Those penalties go away. We get rid of the medical device tax. We take the dollars that are left and we split it among the states. The way we decide what state gets what is we look at everybody in the nation who earns between 50 and 138% of federal poverty level. Then we take each state's percent of that national population. And that is where you begin. Beginning in 2021, the dollars are allocated depending on what percent you have of the total national population within that income level. The state can spend it on those who are a little bit richer or a little bit less rich, but that is where we decide to spend. That's how we divide the money. Beginning in 2022, I think, we put in a risk adjustment. We phase it in so that states that are older and sicker at the end will get a little bit more per patient, and those that are younger and healthier perhaps a little less. But everybody will get the mean plus or minus 10%. We also, towards the end, begin to phase in that the allocation will be based upon enrollment. If a state has enrolled a lot of people, they get a little bit more. If they get less people, if they enroll less people, they get less. Why? As much as the CBO is going to ding us because we repeal the individual mandate, Jonathan Gruber, architect of the ACA, has an article, research he did for MBER, which he published in the New England Journal of Medicine as well, in which he says there is no statistically significant effect of the individual mandate in improving enrollment. Okay. No statistically significant effect of the individual mandate in improving enrollment. What does matter is if a governor gets on board. If a governor gets involved, it happens. In our state, we had a new governor. He decided to expand Medicaid. Louisiana enrolled 450,000 people in 18 months. If a governor's on board, you enroll people. So we incentivize governors to enroll, saying towards the end that the amount of money you get will depend upon those you enroll. But we're conservatives. We don't think that government health care is the best of all. So enrollment counts, finding that the patient who has VA benefits is enrolled in the VA. The person who could get it through her employer, if she had a little extra money for premium support, can receive premium support in order to get it through her employer. We also, by the way, should mention incorporate Ted Cruz's amendment, which was in the Cassidy-Collins bill, which allows a state to put money in a health savings account for the person to purchase her own insurance. I can go on, but our goal is to give patients the power. We think this is a great reform. I'll now turn it over to Dean Heller.
Bill, thank you, and Lindsay, thank you. I want to thank my colleagues and former colleagues to be standing with you today. What I think is a very important moment. Last night I did one of my weekly teletown hall meetings, and I actually had a nurse get on the phone, and the nurse said, finally, under the Graham-Cassidy-Heller-Johnson bill, Congress gets it. They finally understand what's good for America, and finally they understand what's best for the state of Nevada. I remember back in 2012 when Obama was running for re-election, and he was running against Romney, and Obamacare had been in place for 2 years. I said, if Romney doesn't win, it's going to make it very, very tough to reverse Obamacare as we know it today. And I think the last 8 months has proven that that has been a very, very difficult task. In fact, right now, Republicans have come up with two plans, one to repeal but not replace, one to replace but not repeal. That's what we have been doing for the last 8 months, and both have failed miserably. So finally, we've come up with a third option, and that is to repeal and to replace. And I will tell you this, that Obamacare has not worked for all Nevadans. And I'll give you a couple of examples. Just a couple of months ago, 14 of 17 counties in Nevada was going to go bare after the 1st of next year. Fortunately, with the work of my office and the governor's office, we were able to find a single carrier that would actually work for those 14 of 17 counties. But unfortunately, we found one carrier, which means there's no competition and there are no choices. And you know that that's only going to increase costs in those 14 of 17 counties. Another example of how this doesn't work for all Nevadans, we spend in the state of Nevada, pay the federal government over $18 million by individuals, about 80,000 of them, because they can't afford the product that the government tells them they have to buy. So they're paying the fine. Most of them make less than $50,000 a year. Over 80% of them make less than $50,000. So the least fortunate have to pay this fine. Because they can't afford to pay for this product that the government says that they have to buy. As I said, Obamacare does not work for all of Nevadans. So last week, this is even more interesting to me, and that is that I had an interview with a show called Nevada Newsmakers. And the host of that show said that in a discussion with Senator Reid a couple years ago, he said that Senator Reid said that the single-payer system's ultimate goal was, or that the Obamacare's ultimate goal was to become a single-payer system. So 7 years ago, we set up a system that the purpose of it was to get us to a single-payer system, quoting the majority leader of the Senate at that time. Think about that. That was the goal, was to put together a piece of legislation that was supposed to fail. And obviously, that's working out. I don't think Americans deserve this. And frankly, I don't think Nevadans deserve it also. So we need to find a way forward, and we figured that out through Graham-Cassidy-Heller-Johnson. And this plan is the way forward. It is the most reliable, workable solution to achieve our health care goal reforms. And it returns powers to the states, provides ultimate flexibility to governors and legislatures, regardless of whether they expanded Medicaid or not. So under this proposal, our proposal, Nevada actually receives more funding than we currently do under Obamacare. So our plan gives Nevada more money to cover health care costs as it sees fit. This is the way forward. This is how we're going to move not only health care forward, but America forward, our economy forward, by having a health care plan that works for everyone. And with that, Ron Johnson.
Thank you, Dean. First of all, I want to thank Bill Cassidy for all his hard work, Lindsey Graham selling the program, Rick Santorum, and Dean Heller, just in terms of their effort of really doing what Senator Graham said is our last chance of repealing what I think has been a law that has done a lot of harm to a lot of Americans. It's done some good, but it's also done a lot of harm. Lindsey said I was going to mention some numbers. I don't want to disappoint. He was talking about $650 billion spent on Medicaid in the next 10 years. Do you realize only 9 years ago we were spending $200 billion? This year we'll spend about $400 billion. Again, 10 years in the future, $650. Clearly unsustainable. Now, from my standpoint, I represent the state of Wisconsin. We didn't need Obamacare. According to the Wisconsin Department of Health Services in their family health survey, prior to Obamacare, 94% of Wisconsinites had health coverage all or part of the year. Under Obamacare, now it's up to 96%. So, okay, I'll concede the fact that 212 Wisconsinites now have coverage because of Obamacare, but over 100,000 Wisconsinites are choosing to pay the penalty. 82% of those make less than $50,000 a year. And has been the average premium increase in America, throughout America, according to HHS, Wisconsin's premiums have by and large doubled because of the artificial nature, the faulty architecture of Obamacare. In many cases, premiums have tripled. And one thing I appreciate about President Bill Clinton, when he was talking about Obamacare, this craziest thing in the world, he was talking about the forgotten men and women. People that are out there busting it, sometimes working 60 hours a week. Their premiums have doubled. I will say sometimes tripled or more. Their coverage cut in half. They can't afford Obamacare. And that's simply the truth. And what I love about this plan is those forgotten men and women, people like Vern and Sherry Colby, who wrote to me saying they literally had to cash in their 401k, sell their house because they had to pay back the subsidies they got under Obamacare because they made close to $60,000 a week. A year, sorry. $60,000 a year. And they had to pay back and they had to cash in their 401k and basically lose their house. Those are the forgotten men and women of Obamacare that are forgotten by bureaucrats here in Washington, D.C. Those men and women won't be forgotten by governors and by state legislators because government close to the governed is going to be far more responsive. What Graham-Cassidy-Heller-Johnson does is it returns that power to the states. It makes states more responsible, more responsive. And so hopefully those premiums will come down because states will be granted more flexibility. And, of course, it's just going to be a whole lot fairer. Now, in Wisconsin, as proof positive of this, Wisconsin, because of the leadership of Governor Walker and our state legislature, we're the only state that closed the coverage gap, that denied coverage, any subsidies for people that are working poor below 100% of the poverty level. That was good work. That was good flexibility, but we got no credit for it under Obamacare. Under Graham-Cassidy-Heller-Johnson, it'll be a whole lot fairer process, and states like Wisconsin doing right by their constituents will be granted the funding for that. This is a far fairer process. So let me conclude by pointing out what Senator Graham also said. For my Republican colleagues, that this isn't quite good enough. It doesn't do enough of a repeal. This is our last shot. I come from a manufacturing background. I will never let perfect be the enemy of the good. I'm into continuous improvement. Graham-Cassidy-Heller-Johnson is a vast improvement. Not perfect. We're still got a ways to go. There will still be fixes we've got to initiate. But this is far better than Obamacare that literally is leaving behind those forgotten men and women like Sherry and Vern Colby. We can't forget those people. Graham-Cassidy-Heller-Johnson won't. And again, I just want to commend all my colleagues. I want to commend Governor Walker for showing great leadership, rounding up the governors that hopefully they can have a pretty good show of support next week. So with that, I'll turn you over to Rick Santorum.
Thank you. I know it seems like I've been here, but it's been 10 years since I've been a United States Senator. And I'm here because I was watching this process as someone sitting home who is on the Obamacare exchanges and paying over $30,000 in premiums a year and over $40,000 because most of you know I have a disabled child with my deductibles and life. So this was affecting our family personally. And I was watching what was going on in Washington and seeing what I saw was the frustration that I think most Americans see is the dysfunction of not getting anything done. And so I brought an idea forward to Senator Graham. I've been working with Senator Graham and, frankly, with members of the Freedom Caucus, with Governor Walker. He's one of the first people I called to bounce this idea off for him because I learned from experience 20 years ago that when reforming an entitlement, that the best way to do that, particularly an entitlement that shouldn't be at the federal level, that should be at the state level, that you talk to governors and you get governors' input and the governor's idea and you have them provide some leadership. So over the past several months, more intensively over the past 2 months, we've been working with governors. And as Ron said, Governor Walker has been incredible. I mean, really providing tremendous leadership in helping put together this package that you see here today. Other governors have been also helpful. Governor Phil Bryant, Governor Asa Hutchinson, Governor Doug Ducey, all have tremendously contributed to this process. But the real credit goes to Lindsey Graham and then Bill Cassidy, who have been working day and night on this bill, and Dean and Ron also for pitching in and helping pull this thing together. This is the only, as Lindsay said, not only the last choice, but the best choice. You know, Winston Churchill said, America always does the right thing after it tries everything else first. Well, that's sort of where we are here. We've tried everything else first, and this is actually the best idea. And it's an idea that will work because it's proven to work. It's proven because back in 1996, we actually passed the only reform of an entitlement, major entitlement in the history of the country, and that was welfare. It was aid to families with dependent children, which I was heavily involved in. And the reason I came up with this idea is because it's the same principles. And that is, get the money out of Washington, give it to the 50 states, give them the flexibility to design the program, and let them treat the population that the money is designated for in a way that meets the needs of the people sitting across the table from them, not, as Lindsay said, with bureaucracies. It worked in 1996, and we got bipartisan support. Now, I understand that was a different era. And bipartisanship is something that's not in the current lexicon in Washington, D.C. But the idea of compromise and building consensus should be. And that's what this bill does. Ron was right. This bill doesn't repeal everything in Obamacare. And so if you're a purist, you can say, well, everything isn't repealed. Well, let me assure you that in 1996, we didn't repeal everything in welfare. In fact, we spent more money initially than what was being spent on welfare. That's not the case here, but we spent more money and, in fact, targeted for more money for quite some time. And there were a lot of purist conservatives who actually were against welfare reform when we passed it, spoke out against it because it wasn't perfect. It wasn't a good compromise. What this is, what welfare turned out to be, because it's been the most successful reform of a program in the history, it's also been great for the American budget. Anybody know how many times the TANF block grant that was established in 1996 has been increased since 1996? Never. Do you ever hear a governor come to Washington and complain about not having enough money for their welfare program? No, you don't. Why? Because we gave them the money and the flexibility to be able to design a program that worked for them. That's what this bill does. Governors will maybe hem and haw about how much money is in the formula, but we give them the combination of money and flexibility to be able to design something that works best for them. They will save money. They will get better health care for people in their states. And just like we did with welfare, we will get this problem out of Washington, D.C. and have the debate at the local level where it belongs. This is a tremendous opportunity to do something transformational. And I know it may appear last minute, but, well, it is last minute. But it is the right approach at the right time. Welfare reform worked because we were able to balance the interest of making sure that we gave governors enough money and enough flexibility. And for the purists, yeah, it's a lot of money. For the purists, yes, we keep taxes in place. But we get the money out of Washington. We give the governors flexibility. We end, as Lindsay said, the any hope of single-payer health care, try to take that money back from the states after it's had it for 10 years. No chance. We are going to have a fundamentally the biggest reform that we've seen in my lifetime in Washington, D.C., if this bill passes. And so for anybody who says they're for getting power to the people and for getting power out of Washington, to not enthusiastically embrace this, you have to question whether they really mean what they say, because that's exactly what this bill does.
Question?
Great.
Senator Graham, you said that there's been a lack of leadership is one of the reasons that you're at this point. Can you talk specifically what you're talking about? And at this point, Majority Leader Mitch McConnell's refused to say whether or not he actually...
Well, we had a good meeting with Mitch. I think Mitch would vote for it, but he said, go get 50 votes. I need 50 votes. We'll bring it up. We'll debate. You got to get a score. We've had the thing at CBO for about a week. I'm asking Mitch to help me get a score from CBO. Make them work overtime. Bernie will not tell you how much his bill cost and how he's going to pay for it. We can tell you exactly what this costs. It's about $1.2 trillion, and we pay for it by leaving taxes on the wealthy in place, something a lot of conservatives don't like, including me. But we took the taxes in Obamacare and basically left them in place, but block granted the money so that 4 states wouldn't get 40% and level it out. So I can tell you, unlike Bernie, how we pay for it. Mitch said get 50 votes. If you're a Republican out there disappointed in our efforts to repeal and replace Obamacare, help me get 50 votes. Help us. The president. Talked to the vice president yesterday. Mike Pence has been awesome. Said he'd give me a statement. I don't have a statement. Mr. President, help us. The president said if you could get 20 governors, he'd stand with them. Help us get 20 governors. The idea that the Republican Party has done its best to repeal and replace Obamacare is a joke. The idea that we can do this by ourselves is unreasonable. We have given a pathway forward that is fair, that fundamentally transforms medicine in the country, gives patients stronger voice, repeals and replaces Obamacare forever, and everybody's telling us, get us 50 votes and we'll help you. So here's my challenge to the Republican leadership. Act like this matters, because it does. I am not ready to move on. Are y'all ready to move on? I'm not ready to move on. If this bill dies, it's because Democrats say no is the only acceptable outcome to me. I don't want this bill to die because we're just tired of dealing with health care. To the president, I am all in for your agenda. Pick up the phone. Call some governors. See if you can get us to 20. Tell them this matters to you, that you weren't kidding about repealing and replacing Obamacare. You actually meant it. So, Mr. President, help us, because we're trying to help you.
Senator Johnson talks about the importance of governors getting behind this. Can you guys each say if your governors support this, if you've spoken on it?
Mine is.
So far? I figure it's
It's a work in progress.
Work in progress.
I have a Democratic governor. We've met. He understands that my concern is the patients of Louisiana. Frankly, I think even the Democratic governors that win, like in Virginia, probably will not come out publicly for it. Even though if you look at the numbers for Virginia, you'd have to ask Governor McAuliffe why he would not. So there may be some partisanship, but it won't be from our side. It'll be from the other.
Here's what I can say. 18 Republican governors gives you a majority of 18 of Republican governors. We'll get there. We just need a little help. We've got about 14 or 15 in the bank. A few phone calls from the president and vice president. You get to 20 pretty quickly. To Senator McConnell, he's supportive of the idea. Help us get a CBO score. Let the conference know we're back in the fight here. We got plenty of time. I don't know what we're going to do between now and September the 30th, but how about this idea? Argue about something that matters to the American people. How about this idea? Don't quit on repealing and replacing Obamacare. Keep fighting to the very last tick of the clock.
Lindsey, can I make a point?
Yeah, yes, you can make all the points you want.
When it comes to different states, obviously non-expansion states like Wisconsin are going to finally get some equity in terms of the distribution of Obamacare dollars. And so, for example, my junior senator, Senator Baldwin, ought to be completely in support of this because this really benefits Wisconsin. There are other senators, for example, Senator McCaskill. Missouri would highly benefit from this. So I think Senator Graham's approach on this thing is, and Senator Cassidy's been, let's make this equal, and there ought to be a great deal of pressure on Democrat senators as well to do right by their states, starting with Senator Baldwin.
Let's do
Senator Cassidy, your committee that you sit on is currently working on a bipartisan solution to stabilize the market. Does this mean that you're kind of giving up on regular order and a bipartisan idea for the market?
The cost-sharing reduction payments are not included here. The parliamentarian had ruled the cost-sharing reduction payments cannot be included in a reconciliation bill. So what we're doing does not compete with that which is going through HELP. It complements that which is going through HELP. Okay? Yes, ma'am.
One of the criticisms of this effort has been process. And if you guys are successful here, this bill would pass within the next 17 days. Is that a process that you guys think is appropriate for something so big?
You know, I'll let my colleagues comment, but you play with the hand that's dealt you. Would we have liked this to be the first option as opposed to the last? Absolutely. But the heart and soul of what we're doing here was included in Cassidy-Collins. And I went to 10, between Susan and I went to 10 different Democratic senators, I think, at top of mind, maybe 8, maybe 11. And all of them said they couldn't collaborate with us. Now, it's a little disingenuous to suggest that if we had had all these hearings, it would have made a difference. When behind closed doors, folks said, sorry, great ideas. And yes, there's people in my state being hurt, but we can't help you for political reasons. So, of course, I'd like the better process, but you play with the cards that are dealt to you.
Can I ask? Can I address it? First off, a big chunk of this bill is the Medicaid block grant / per capita cap.
Going through CHIP.
The first block. The first block grant. So that's been out there for a long, long time. It's been voted on. There's nothing new there. The second is a fairly simple concept. This is not very complicated. It is taking all the Obamacare spending, getting rid of it, getting rid of the tax credits, getting rid of the cost sharing reduction payments, and getting rid of the Medicaid expansion dollars. Medicaid expansion ends at the end of 2019 under this bill. And then we do a block grant. This is not complicated. You can say we need lots of hearings. The reality is a very simple concept, one that's been around for a long time. So I think that this is, methinks thou dost protest too much when it comes to not having knowledge of what's in this bill.
Senator Heller, earlier this summer you came out strongly against plans that would greatly reduce both the Medicaid expansion spending and traditional Medicaid spending, saying they'd be very bad for your state. What's changed?
Yeah, that hasn't changed. In fact, I'm doing exactly what I said I would do, and that is work with the governor of our state. And yes, you are correct that we are a Medicaid expansion state. We actually get a 30% increase in health care spending in the state of Nevada with this piece of legislation. So if our governor and our legislature like the Medicaid program that we currently have, not only can they keep it, but they could expand it if that's what they choose to do with the 30% increase in spending. So we're telling all 50 states, do what's best for your constituency. And this is a bigger and better product. To me, it's like Apple coming out with the iPhone 10. All right? If you don't want to buy it, you can keep your iPhone 7. But there is an iPhone 10 out there, a bigger and better product, if in fact your governor and your legislature wants to put that package together. If you like your iPhone 10 or 7, if you like the Medicaid program that you have, you can keep it. We're not dictating to the states what they can do. So we're giving our governor and our legislature the opportunity to keep what they have, and if they choose, they can expand it or take a look at other health care products that are out there and move in that direction.
Dean made a very important point. The second block grant that would have been money going to refundable tax credits and to bail out insurance companies is now block granted back to the states over a 10-year period that achieves parity. You can take up to 15% of that block grant to help with traditional Medicaid. So the bottom line is we're making traditional Medicaid sustainable. Somebody needs to do that, and we're putting money back into the hands of states that they would never see, and basically they can design systems that work for them. If you want to repair Obamacare, you can. If you want to reimpose the individual mandate, employer mandate, you can, but you don't have to. If you want to do something new and novel, you can. As to the process, we passed Obamacare on New Year's Eve, Christmas Eve. I remember it very well. I think we can do a hearing on this bill. I'm asking Senator Hatch to give us some time to explain our bill to the Finance Committee. We can go right back to the floor and continue where we left off in voting. We've got time to bring this up before September 30th. All we need is leadership. I'm urging the White House to get on the phone, to call governors. I'm urging the White House to urge the Senate leadership to re-engage. I'm asking Mitch McConnell to make time for this bill and this debate and help me get 50 votes. I'm telling the Republican Party we have not tried everything. As a matter of fact, the best idea has not been tried. So I want to make sure that when we leave health care, if we do, and we fail, it's because Democrats said no to a transformational idea. I like New York, California, Maryland, and Massachusetts. They're wonderful states. They're fine people. I don't like them so much as to give them twice what everybody else gets.
Talk about how this bill deals with people who have pre-existing conditions, but states be able to do anything differently. How does that work?
So we run the program through the CHIP. We run it through CHIP, if you will. And the same kind of block grant approach CHIP originally was. The state will get a certain amount of money for those between 50 and 138% of federal poverty level. President Trump, when running for president, very much emphasized he wished to take care of those with pre-existing conditions. So we continue right now the statement that you need to be able to provide insurance. Part of the problem with those who are sicker and older is their risk pool becomes very concentrated. So we have incentives in there and mechanisms in there whereby the state can expand the risk pool, and instead of the individual market, what it currently is, which is just the older and sicker, rather it becomes a broader risk pool, including the younger and healthier. A state, for example, could do automatic enrollment, where all the young, healthy folks are then included, and the state would give that young person a premium sufficient for their annual cost. Well, now you've included the younger people in, and that automatically lowers the cost for those who are older and sicker, those who are pre-existing. Our Blue Cross Louisiana has told us that under such a mechanism, we would reduce premiums in Louisiana by as much as 20%. So we give states lots of options as to how they can address those with pre-existing conditions.
I'm going to just, because Bill gave a great answer. He gave an answer that I would give, but I'm not too sure he specifically answered your question so you would understand it. So no offense, but he gave a very complicated answer, which he answered your question, but I'm not sure that he necessarily communicated that. So the answer is the Title I that says you cannot discriminate against is not changed in this bill, nor is the guaranteed issue changed in this bill. There are other things that are, but those two are not.
Thank you very much.
What about Hyde Amendment abortion?
If we go through the CHIP program, Hyde protections are maintained.
Yes.
Yes. Okay.
What Title I changes are made in the bill? Are you guys trying to do something similar to the Cruz Amendment?
I'll let Bill talk about that. But before we do that, let me tell you, Rick came to me in the barbershop and said, we ought to do a block grant. I had opt out of Obamacare as an option. He said, why don't you just go bigger? This is what we did in 1996. Said, that's really appealing. Then we started coming up with the idea of parity. And Bill Cassidy, above all others, has spent hours upon hours working with Rick about the minutia to make sure that, one, you don't build football stadiums with the money. You got to help sick people. But we're trying to give as many approaches to helping sick people as there are out there. Under Obamacare, the innovation is almost zero. Under our block grant approach, the innovation is pretty wide. But we do not. There are guardrails. And we're trying to get more flexibility to Title I. But I'll let Bill talk to you about what we do.
And as you compliment Santorum and Cassidy, Cassidy compliments his staff, who's put in more hours than I have. As regards the, as well as Senator Graham's staff and Senator Heller's staff, the Cruz amendments. There's two Cruz amendments. Let's just be clear. First Cruz amendment that I mentioned was the allowing the states to put money in health savings accounts to purchase insurance. We include that amendment. The second Cruz amendment will also have kind of a flexibility in there. The parliamentarian, I'm not sure, is going to be wild about that amendment. So they have another set of language that we're including that we think would hopefully pass muster with the parliamentarian. It may not. We have to recognize that. But by putting it through the CHIP program, we recognize that the Secretary has great ability to provide waivers. And no governor has ever complained that I know of about CHIP program being too restrictive as to what she or he may be able to do. So we think by putting it through the CHIP program is going to give flexibility. The AV value, the actuarial value included in the CHIP program is less than that required of the Medicaid expansion under Obamacare. On the other hand, I never hear a governor complain about the actuarial value requirements of CHIP. And so we think with existing legislation, we kind of end up where we need to be.
And I've had to listen to this crap for 2 months, so he's really smart, and I'm ready to vote. You want to say something about?
Because I don't think anybody, those of you who've been covering this, nobody fought harder to bring down premiums that have been artificially increased because of Title I of Obamacare. But what you're finding with the flexibility for the states is a block grant program. For example, Maine initiated guaranteed issue, did not repeal it, supplanted it with an invisible high-risk pool. Minnesota's instituting something else, waiting for the waiver. I'll hopefully get that quickly. So again, I believe this bill, by granting the flexibility and the funding, will give the states the ability to do those very innovative reinsurance types of programs like invisible higher risk pools that will bring down premiums. So again, my colleagues who fought with me to lower premiums, I think this bill will do exactly that. So again, I want to support that. And one last point, I'm Chairman of Homeland Security. If either the Finance Committee or Health Committee won't hold a hearing, I'll notice one this afternoon. We will hold a hearing on this prior to September 30th.
I just want to supplement what Bill had to say on what flexibility is in the bill. There is language that we hope to get by the parliamentarian that will provide flexibility for the money in the block grant. So it will be tied to the block grant and to the money in the block grant. It will provide some flexibility through the waiver process for governors to be able to get waivers on certain elements of Title I of Obamacare.
2 more questions.
Critics of your approach say that one problem with it is that it's going to deeply cut Medicaid. Obviously, you're upset about this line here going up, so that implies that under your bill it's going to go down.
Yeah.
How much is it going to go down?
Well, in year 8, we began to lower the growth rates of Medicaid closer to medical inflation. What is medical inflation, Bill?
CPI.
Okay. So bottom line is Medicaid is growing a lot faster than medical inflation in general, to the point that it crowds out the federal budget. So in year 8, for a category of people, we began to lower the inflation rate. The belief is that the flexibility we grant to governors will allow them to get a better result and begin to bend the cost curve. This is unsustainable. Medicare is even worse. By 2038, all the money that you send in taxes go to pay for health care, interest on the debt. There'll be no money for anything else to run the federal government. So this is a very slow, I think, balanced approach to allow states to prepare for an inflation rate that is more sustainable. Nobody gets cut. The inflation rate for populations begins to change, and I think we give people plenty of time, and we also allow you to take 15% from the second block grant to help with traditional Medicaid. So Dean Heller was the guy that everybody was looking to on VICRA. Dean was the guy. Where will he go? Because he's in a tough race. What will he be able to tolerate politically? Dean did something that I wish every senator on our side would do. Instead of being worried about how this looks politically, he started shopping around for better ideas. And when we approached Dean with a block grant approach and showed him that money will be coming back to your state that would have gone to New York, California, Maryland, and Massachusetts, that your state will have more flexibility, that you can actually get better outcomes and your people will be listened to under this approach and will never be listened to under Obamacare, he signed on. And the reason he signed on, it turned out to be good for Nevada, but I'll tell you this. I think Dean and Ron, of the 4 of us up here, really believe that we have got to start getting our fiscal house in order. And if you take health care off the table, it can never be reformed, then our best days are over. Bernie, today, is going to propose single-payer health care, Medicare for all. He won't tell you what it costs, and he won't tell you how he's going to pay for it. But I can tell you this. Medicare and Medicaid by 2042 alone are consumed the entire revenue stream of taxes to be collected in the future. What Bernie is doing is a great disservice to our country because it will make us Greece. What we're doing is getting money closer to where the patient lives in the hands of the people that you can complain to if you don't like the outcome. This is truly transformational.
On that point, you've cast this as sort of a counterweight to what Bernie Sanders and the Democrats are going to do. They will make the argument that their plan says something about their values, that every American should be...
And they're right.
Well, so what does this plan say about your values?
That this plan says to the American people that we value input by people, that we believe the government closest to the person is the best form of government, and we believe that health care closer to where you live is better than health care managed by somebody you'll never meet who is not elected. This is a debate worthy of the United States Senate. I think what Bernie is doing is going to destroy quality over time, going to make it unsustainable for future generations, and we will become Greece. What we're trying to do is be generous with money, but insist that people have the innovation they will never have to deliver better health care and eventually control cost. Our values, I'll let everybody answer that question because it's great. Here's my value. My value is to leave behind when I'm gone better health care that your grandkids can afford, give you somebody that you know who's in charge that will listen to you because you vote for them. That's what I value.
Quick point on single-payer systems. If you want to look at what a single-payer, government-run bureaucratic health care system looks like, go to the VA system. See how, how good we have found that system to be. And that's exactly the path that Bernie Sanders is leading us down. In terms of the Medicaid, here's some rough numbers. Under the Senate plan, which this largely maintains in terms of core Medicaid, we were saving about $12 billion spending close to $3,000 billion. So we're just barely beginning to restrict the growth rate of a completely unsustainable entitlement. And from my standpoint in Wisconsin, where we didn't expand, people on Medicaid, the disabled, elderly, children, they were concerned about what Medicaid expansion was going to do in terms of threatening core Medicaid. And let's face it, Medicaid expansion was directed toward working age, childless, able-bodied adults. And when I talk to people, for example, cerebral palsy, and I point that out, their comment was, well, those people shouldn't get Medicaid. And I think they're right. And it's the Medicaid expansion, so Obamacare, that's putting at risk core Medicaid.
One last question.
Senator, you were talking about how the White House needs to get involved here and start making calls and making efforts. But with all due respect, he was unable to move the needle on health care back in
I don't know.
So what's different now?
Well, he delivered in the House. It was the effort of President Trump that got the House over. One phone call, I think, by the president will get us more than a handful of governors. We're at 14 or 15 already. When the President of the United States calls you as a governor asking you to help him give you more money and more power, most people are going to say yes. And about values, Bernie can't tell you what his bill cost. He can't tell you how he's going to pay for it. We can. We value being honest. We're going to tell you exactly what we're going to spend, how we're going to pay for it. So the President of the United States is not just somebody. He's the most powerful person in the country, and he's the head of our party. So I really believe if the president spent a little time with the vice president making phone calls to governors, telling them how much better they do, how much more control they'll have, and how much better their states do, that we can sign up a bunch of people pretty quickly. So end with this. Today is a monumental day for the American people. You got two different approaches to how to deliver health care in the future. The Bernie model and our model. I am so glad that Bernie chose today because he's a good man. And in his heart of hearts, he believes the only way to be fair is to have the federal government decide health care for everybody, no matter what it costs. And here's what we say. The best way to be fair is to make sure that the people in the country get basically the same contribution no matter where you live, and the people in your local community have control over the outcomes, so you'll have a voice if you don't like their decisions. To my Republican colleagues, don't let the health care debate die. Don't leave the field with your tail between your legs. Keep fighting. To my Republican Senate leadership, help us. Thank you all.
Thanks, everybody.
Thank you.